Hello, and thank you very much for taking the time to watch this video to help you know where and how to book appointments for patients registered at your surgery. During this video, I will let you know when to take screenshots so you can refer back to important information at your convenience. My name is Fahanda and I am the manager at Phoenix Sunrises PCN, lovingly referred to as the PCN by your GPs. We have various staff roles at the PCN, including physician associates, paramedics, health and wellbeing coaches, care coordinators, a pharmacy team including clinical pharmacists and pharm techs, social prescribers, leads and supervisors. And we aim to support our 5-member practices and their staff with our services. The practices we cover are Malsyard, Neville, Pastures, Conway and Kingsway, which was formerly Kingsway in Birmingham. We at Phoenix aim to be at the forefront of the transcending model of healthcare from that old reactive primary care GP practice model to a new collaborative primary care network approach. Our mission is to transform our teams and patients to manage their health and well-being proactively and holistically, to empower GP practices in innovating ways that will ease the burden on their workforce, whilst at the same time improving access for patients to the right healthcare professional. This evolving model of healthcare has a vision to not only triumph in our mission to accomplish this transformation, but to cascade this to our staff and patients, raising standards of well-being for all. This training module has been built with the aim to give you the confidence to book into correct appointments and locations so that you can free up your own practice appointments and provide better access to your patients. This is a comprehensive list of the signs and symptoms where the receptionist should insist on the patient calling 999 or going to A&E immediately. Please take a screenshot of this page. Patients telling you of these signs and symptoms should not be booked with the practice or the PCN. If the patient is physically in the reception with these symptoms, an alarm bell needs to be raised for a clinician to immediately attend, interrupting their clinic if necessary. I'll whiz through the list, but please take your time to become familiar with it. I'd like to highlight the difference in presentation in brown or black-skinned people when I get to it. So in adults, it could be signs of a heart attack, and we know that's chest pain, pressure, heaviness, tightness, or squeezing across the chest. Signs of a stroke, face drooping on one side, or if they can't hold their arms up, difficulty speaking. Suicide attempt, choking, heavy bleeding. And when we say choking, it's choking in the moment, not after they've choked and they're okay now. Heavy bleeding, severe injuries, seizure, fit. In children, some of those are duplicated, like seizures, choking, but you'll have additional ones like difficulty breathing, unable to stay awake, blue or grey, pale or blotchy skin, tongue or lips. And this is where I would like to highlight that the difference in brown or black-skinned people would be grey or blue palms or soles of their feet. The child is limp or floppy, heavy bleeding again, severe injuries, signs of stroke, which are very rare but have been known to happen, sudden rapid swelling or sudden confusion. We provide a minor illness service covered by physicians associates and paramedics. Sometimes these clinicians will be at your practices and you can book into their rotas directly on your system. For some practices, due to lack of clinical rooms, we provide appointments at the PCN and you can book onto these rotas too. Only patients over the age of 1 should be booked into these clinics. So what you need to do is first retrieve the patient, then click on the appointments tab at the top, choose remote booking, make sure all units are selected and the correct drop-downs are chosen for the clinics, double click on the rota that you want to select and double click on the appointments to book in. Please add a brief description of the problem so the clinician is prepared. If you do not see any clinics in the morning, please check throughout the day as new clinics get added in any time of the day. And all of these appointments are face-to-face. Please take a screenshot of this slide. These are the types of appointments that can be booked in with the minor illness clinicians. I won't read the list out, but please take the time to familiarise yourself with them afterwards or refer back to your screenshot. If the clinicians are booked with something outside of their remit, they are able to refer to the GPs for advice, but it's always best to avoid wastage of appointments by booking in the appropriate appointments with the appropriate clinicians. Phenotesting service is provided at the PCN Birmingham site only. The phenotest checks a patient's nitrogen oxide levels in the body and can be helpful in diagnosing asthma. Pheno clinics are run by care coordinators every Thursdays at the PCN hub only at Birmingham. Appointments are all face-to-face and are roughly 30 minutes. Anyone between the ages of 5 to 80 can be booked into the clinic. Please ensure patients are sent appointment confirmations alongside the address of the PCN, which you will see at the bottom when you book them in remotely. So again, this is how you book in, same as the minor illness remote access appointments. You select the patient or retrieve the patient first of all. You click the appointments tab at the top, choose remote booking, make sure all the rotas are showing, select phenotesting hub if you want to PCN hub if you want to filter down, and double click on the rotas to show available appointments. Inform the patient of the time, date and location of the appointment. The member practices of our PCN provide enhanced access appointments in conjunction with Avexia. Avexia is the GP Federation for Luton. These appointments are available after surgery hours, Monday to Friday evenings and on Saturdays. So Avexia normally run a winter access clinic from December to the end of March with additional appointments. They can be with GPs, physician associates or advanced nurse practitioners. But the existing enhanced access service, there are multiple staff available, namely GPs, physicians associates, advanced nurse practitioners. The advanced nurse practitioners and physicians associates see the same appointments that the minor illness clinicians see if you refer back to slide 4. HCAs will also see dressings, learning disability checks, BPs, new patient checks and ear syringing. For ear syringing, you need to double book. So each appointment is 20 minutes, so you need to book 2 appointments, and if they're having both of their ears syringed, then it'll be a 40-minute appointment. Practice nurse, they can do learning disability, serious mental illness, diabetes reviews, asthma reviews, B12, dressings and sutures. If you're booking in with any of the clinicians for dressings, please make sure to provide the dressings to the patient before they attend the appointment. We have severe mental illness rotas, only book patients with diagnosed severe mental illness onto these rotas. And the pharmacist rotas, you can book in general medication reviews, structured medication reviews and medication queries. So we have 2 full-time equivalent care coordinators allocated to practices. They can do diabetic reviews, telephone asthma reviews, care processes and foot checks, but they tend to be utilised for their ability to take bloods more than anything else. We should soon have a remote service ready for ECGs and train them fully to hypertension reviews. Coaches have longer appointment times and their time is useful to dig out whatever underlying issues have been preventing patients from achieving their health goals. If a patient is a high user of your service, it may be an idea for them to spend a session with a coach who can have time to address their issues in more depth. They generally tend to see more patients who have mild depression or anxiety, low mood or motivation, stress, sleeping problems, weight management, lifestyle concerns, that could be exercising or diet, and some support around compliance and goal setting. So the FCP MSK service, there is a standalone training video on this service already sent out to your practices, so please watch that for more details. But the highlights of that are that these are remote rota appointments, so booked via the remote booking, as we've mentioned before, and you can book selecting the MSK specialist rota. Just want to highlight that these are based in Kingsway Medical Centre in the basement rooms. So for any patient who calls in for an appointment who you would normally book in with a GP because they have a muscle, joint or bone problem, book these with our MSK FCP service to free up your GP appointments. But do remember to tell the patient that this is a specialist clinician who's trained in being able to deal with their problem, just like the GP. But they are not GPs. They will be able to refer onwards or request any scans or tests if needed. Please make sure to familiarise yourself with the inclusion and exclusion criteria on this slide. Take a screenshot if needed. These are face-to-face in-clinic appointments only for patients over the age of 16. We have a pharmacy team at the PCN who do a variety of work for us. They will be based in practices as well as at the PCN. They conduct structured medication reviews not only on our housebound list but also on the practice registered patients. They do general medication reviews for patients on 5 or more medications, drugs monitoring, medication reauthorizations, medication queries, synchronizations, and audits and drug switches. Home phlebotomy. If you have a housebound patient who needs to have a blood test, please email ccs-tr.phlebotomyluton@nhs.net and send them across the blood form. So here is a list of current projects running or being designed to run in the coming days at the PCN. We hope to kick off the ones with stars next to them by July 2024 or earlier if we can. Those ones are currently in the planning stage, but this will give you a flavour of the work that we do at the PCN. So we have a care home service where we look after the patients registered with you but based in care homes, a frailty and housebound service where we can do reviews and any work that the GP asks us to do for housebound patients, minor illness service that has been discussed earlier, complex diabetes pathway which is in the process of being built, younger person's diabetes, which is ongoing and has almost been completed for this year. Group clinics for diabetes, they are currently in the design stage. Social prescribing clinics, where you task into the PCN hub to our social prescribing team. Citizens Advice Bureau clinics, we have them running at the PCN, but these will be filtered out from the social prescribers, booked on here at the PCN. So if you feel that a patient needs to see a Citizens Advice Bureau, you can just send a task into the social prescribers task box in the PCN and they will book them in themselves. Group clinics menopause coming in the future, hopefully later on in the year. Prostate cancer clinics, dementia clinics, bloods and phlebotomy that we've just been through, pheno-testing we've already discussed, diabetes reviews and asthma reviews that the care coordinators help with. We also have supervision, coaching, dementia training for your staff, basic life support training for your staff, educational workshops, not only for your staff, but these are for patients as well. ECG clinics planned to be started by the end of June, and reception training, and this is one of the examples of the reception training that we are preparing. Right, so thank you very much for watching this video. Just a reminder that there are additional videos like the FCP MSK service video and more to come out, so do keep an eye out. We would love to have some feedback or ideas to help improve our services. You can contact us by sending a task to the admin team on the PCN hub via System 1. Or you can contact us on blmkicb.phoenixpcn.cc@nhs.net. Thank you once again.